Yes, sir. Good afternoon to everyone. Thank you for joining us this afternoon. I'm Arsenio Runyon, Chief Executive Officer of the East Liberty Family Healthcare Center. On behalf of our Board of Directors, our committed providers, our wonderful staff, and more than 10,000 patients that we serve annually, thank you for being with us today. East Liberty Family Healthcare Center is a mission-driven, federally qualified health center that has served the Pittsburgh community since 1982. We proudly operate in 4 locations: East Liberty, Lincoln Lemington, Uptown, and Wilkinsburg. We are a provider able to see patients regardless of their ability to pay, underserved, underinsured, uninsured populations. We have multiple services here: primary care, dental, behavioral health, substance abuse, pediatrics, and 2 pharmacies, with a strong focus on health equity and whole person wellness. We are here today because our work and the people we serve is under threat. Not only do I represent FQHCs, but I represent FQHCs across Pennsylvania and across the United States. It is often mentioned that federally qualified health centers are the best kept secrets, which that is a detriment to us as FQHCs. We are the safety net to large healthcare systems. And right now, we are truly under attack. But thankful today, we're able to raise our voices, and we're able to have political support. We're able to have support on all different areas and facets of life. But today, our officials and supporters are here. We're certainly grateful for Congresswoman Summer Lee, who's a steadfast advocate for equity and justice. We are certainly grateful for our mayor, Mayor Ed Gainey, who's a voice for every neighborhood and for every neighbor. Senator Lindsey Williams, a tireless supporter of accessible care, and Senator Jay Costa, a longtime partner for safety net providers. We thank you for your presence and your partnership today. But not only that, we need to understand the realities that we actually face. These proposed federal budget cuts under the H.R. 1 would eliminate Medicaid coverage for over 300,000 Pennsylvanians, with more than 25,000 at risk right here in Allegheny County. We have to understand something, that this isn't just a policy issue, but it's a public health emergency. What do these cuts mean? I want to break this down so that everyone has a very clear understanding. Working mothers are now forced to have to skip checkups. Seniors will now be delayed with critical medications. And then greater than that, we have children who will now lose access to basic care. And health centers like ourselves, federally qualified health centers and rural healthcare centers, will shut down across the state. This is a crisis, and this is something that we need to make sure that we address very quickly. Why does this matter? Because our mission has never wavered. We have a commitment, we have a calling to serve those who are unable to speak up for themselves. We have a calling and commitment to ensure that future generations are able to have equitable care, equitable and wonderful health care, so that they can live to be able to see some of our ages. It is important so that even the ones who have paid their dues, who have sacrificed for us to be able to stand on their shoulders, to have access to decent care. And it's time for us to speak up. At this time, I want to introduce the wonderful Congresswoman Summer Lee and ask for her to give her remarks. Thank you, Congresswoman.
Thank you. Good afternoon. We call it good anyways, even as the fight goes on. I want to thank everyone who's here, who's convened, the people who have been in this work. You said it, right? This isn't just a policy issue. This is a public health issue. And I think that sometimes when we hear about what's going on at the federal level, it feels maybe abstract, like it isn't touching us in our real lives. And I'm here to tell you, this is touching people. There is nothing abstract about this bill. a reconciliation process about the very people, the communities, the providers who are going to be deeply, deeply impacted by this. In the richest country on earth, no one should be forced to choose between life-saving healthcare and putting food on their table. Yet, once again, the Trump administration is trying to rip that basic dignity away from millions of working class families through this so-called one beautiful bill. But let's be very clear what this ugly billionaire bill really does. It cuts Medicaid, as we've been talking about. It cuts CHIP. It abandons our most vulnerable communities. In PA 12, these programs aren't abstract. Again, our numbers on a spreadsheet. Without Medicaid, right, rural hospitals would close. Community health centers would have to lay off staff. Children will go without the basic care that every child deserves. Trump would rather gut funding for rural hospitals and federally qualified health centers, places that are often the only sources of care in underserved communities and already struggling, just so billionaires could make a quick buck. Because I'm not going to be the one who minces words about why we are here today. So when House Republicans voted to cut Medicaid in this bill, they didn't just vote to balance a budget. Their vote meant cutting off chemotherapy for cancer patients here in our region. Their vote meant taking away speech therapy for kids. Their vote meant forcing seniors right in Homewood and East Liberty and Larimer to skip their prescriptions so they can make rent. These are real people, they're real lives. And I know we are all thinking about every single person who is impacted in very real life. Medicaid is the backbone of healthcare in PA 12 and across the country. It covers 1 in 3 children, nearly half of all births, and provides long-term care for millions of seniors and people with disabilities. The program saves lives, and we don't have to be, and we're not trying to be hyperbolic or dramatic. The cutting it will literally cost lives. This administration is putting a price tag on the cost of working class families, and it's a despicable truth that we have to face. But as we always say, as I always say at least, I think we all do, the power of the people is greater than people in power. And we can't back down now. I know that right now as we talk about this, it feels like all hope is lost. We are still in the reconciliation process right now. This bill is still over in the Senate, where we have, especially in Pennsylvania, an opportunity to impact this process. We have the opportunity to reach out to our senators and put that pressure on them to let them know how important it is to our federally qualified health centers, how important it is to the children of Western Pennsylvania, to our disabled seniors and adults, how important it is to every family, every neighborhood, every community. We have an obligation to make that known so that when we look up and we're at the end of this process, they can't possibly say that they did not know what the impact of this would be. So that's why we're here today. That's why I'm so thankful for the advocates. I'm thankful for your courage, for caring for your neighbors, for keeping them healthy and alive here in East Liberty and across the country. I believe that it is now my honor and privilege to introduce up next our mayor, Ed Gainey.
Good afternoon, everyone. Good afternoon. I agree with the Congresswoman. It's a good afternoon, but this is difficult times. We're in a place right now that serves a lot of people, particularly a lot of them that are my neighbors, a lot of them where I grew up with their children, and I know how much they desperately depend on East Liberty Family Health Care to provide the type of services that they provide. So I want to thank you for your advocacy.
Thank you.
I want to thank you for doing what you do, because it's extremely important. You know, at the end of the day, Medicaid is a lifeline that a lot of people depend on. And when we start to talk about Medicaid and what it means to so many people, the reality is that this administration doesn't care about the people that are in underserved communities. All they care about is how they can make their billionaire friends rich. And it's up to us, the people, to be able to fight for Medicaid and Medicare. Because everybody here knows somebody that is dependent upon it. And if we don't speak up, then who will? It ensures that a child with developmental issues can receive early intervention. Somebody with cancer can get their treatment. Someone with diabetes can be taken care of. This is not just cuts about dollars and cents. This is 100 small cuts to our people. people that need these services every day, people that I've watched grow up that don't have it, that come to federally qualified healthcare system just to be able to get the help that they need. I have 2 neighbors on Apple Street that come here. I know what this means. I know how much Medicaid means to them. We know, not from just a political point of view, I know from a personal point of view. But I also know some of those people don't have the voice to speak up. So they call on us. And now we call on you. We call on you to help us to make sure that you call, as Congresswoman said, your senators and let them know that they have a moral obligation to help people. They have a moral right to do what's right for our people. Not doing what's right and serving a president that wants to be a dictator, a people hater, is not the way to go when we talk about the lives of our people. It's up to us to speak up. And if we don't speak up, shame on us. We could do a press conference, but what you gonna do? What you gonna do? That's what this comes down to. So I want to make sure that as we speak about leadership, and as that we speak about a time like these, a time like this, I should say, let me say this. We've been here before. This is nothing new to some of us. Dark times is places that where you grow character. Adversity is a time that you show up who you are. So we got a dark time in America. And we worried about the heat of adversity. No, it only does 2 things. Pressure's a privilege. It can either make diamonds or bust pipes. Don't let the pressure DC bust your pipes. Look at your neighbor and explain to him why they diamonds. Thank you.
Yes, sir.
And next up is Lindsey Williams, Senator Lindsey Williams.
Thank you, Mayor Gainey, and thank you to Arsenio and the entire staff here at East Liberty Family Healthcare Center for hosting us today and for all of the work that you do every day to take care of Pittsburghers. I'm State Senator Lindsey Williams, and it's my privilege to represent East Liberty and Lincoln-Larimer, the 10th, 11th, and 12th wards of the city of Pittsburgh, the North Hills, the Allegheny Valley, in Harrisburg. I'm incredibly proud to be here today with our federal, state, and county officials to stand up for Pennsylvanians against Medicaid and healthcare cuts that will directly result from this budget. The East Liberty Family Healthcare Center and our other federally qualified healthcare providers do amazing work in providing quality, comprehensive healthcare to everyone who comes through their door, regardless of their ability to pay. They understand the importance not just of primary care, but whole healthcare, dental, pediatrics, mental health, and more. But their ability to provide this care is care that everyone relies on. It relies on Medicaid and other health insurance reimbursements. In a city of healthcare giants, it seems crazy to think that so many people rely on federally qualified health centers, but they do. That is the reality. And without Medicaid, places like East Liberty would have to either cut back services or start turning people away, and no one wants that. We don't want to do that. But they aren't the only ones who suffer under proposed Medicaid cuts. Since the cuts were proposed at the beginning of the year, my office has heard from so many constituents. And I wanted to tell you just a few of those stories here today. One constituent told us about how her mother, who lived independently but had recently fallen, was able to get in-home care support so she could stay in her home and remain independent. Another person said that Medicaid supports allowed him, a handicapped person, to stay at home with his wife instead of having to move to a care facility. We also heard from parents. One constituent said she cried when she found out that her daughter's Medicaid was covered because it meant that her daughter would be able to learn how to walk. Other parents have emphasized how important these funds are to providing care and services to children with autism, allowing them to learn and to grow. So I think that's important, as we often talk about the people who are on Medicaid right now who are hurt, but you never know when you're going to need it. You never know when a family member is going to need it. You never know when you're going to have a child or grandchild who's going to need Medicaid. And that is really scary for people. They're our friends, our neighbors, our community. they're with all of us, and we're just one trip and fall, one car accident, one healthcare emergency away from needing those services ourselves. And also, those costs of uncovered care can't be absorbed by medical providers. If they're not coming here to East Liberty, they're not getting their preventative care, they're showing up in the ER. They're increasing wait times. They're increasing costs. If you never are on Medicaid, this affects you. And for our friends in rural communities where the hospitals are on a razor-thin margin, cuts to Medicaid mean that they close their doors. Or they risk getting taken over by private equity firms who close their doors down the road so they can make a buck. And we've seen that happen in other parts of the state. And now the U.S. Senate, we found out last night, is proposing cuts even further than what the House proposed, slashing funds that states use to fund their share of Medicaid costs. That means that we'll lose federal money, we'll also lose the ability to make up some of that back. I can't think of a much worse way than to take health care away from our seniors, our veterans, our children, and our individual disabilities to make rich people richer. A constituent asked me to please be our voice when it feels like we have none. It's my honor and privilege to do that today with all of my friends here. Enough is enough. If you're watching this, please call your U.S. senators. We can make a difference. It only is us working together that's going to make a difference. And with that, I want to introduce my friend and colleague, Senator Jay Costa, who's our minority leader and is fighting for us with the Pennsylvania budget.
Thank you very much, Senator Williams, and I want to thank my colleagues who are today, Congresswoman Lee and Mayor Gainey, and collectively we're raising our voice about how important it is that we have this conversation. It needs to go beyond East Liberty. It needs to go across this Commonwealth and to other areas of this Commonwealth. As we talked about some of the impacts we've learned about, the hundreds of thousands of people who won't have access to health care. What we have here is a beautiful facility that provides comprehensive care for so many. And to think about these services will be diminished because of somebody in Washington doesn't want to recognize how important they are, what they mean to this community and surrounding communities. It's unconscionable that we're even here. I know this bill has been referred to the big, beautiful bill. That's not how we see it. That's not how our Democratic colleagues in the Senate, all 23 of us are locked together to make certain that we're going to do everything we can to fight to preserve the programs that we know, to preserve the Medicaid program and the reimbursement rates. When you stop and think about just one aspect of this budget bill that's going to impact the Medicaid expansion program, think about that came out of the Obamacare, a program called Medicaid Expansion that provides for working individuals a modest level of health care. Over 800,000 people have access to that program. That is in jeopardy of being significantly reduced, and the number of people who are on that roll today will diminish significantly, and hundreds of thousands of folks who will be rolling off and rolling back on. And that's by design. That's exactly what they want to be able to do to try to save resources, prevent folks from having health care. And as Senator Williams talked about, they present themselves not here at health centers, because they may not be able to do that, but they present themselves in emergency rooms and increases the cost of uncompensated care for our hospitals. And as was stated, they pass on those costs that the hospitals absorb. They pass them on through the insurance, through the premiums that are increased. So if you're not a Medicaid person, but you're home sitting watching the news or whatever you may be hearing this presentation, you will understand that your insurance costs will go up because of what's taking place here. That's a fact. And so many people won't be able to avail themselves to the services that are so very important. So I'm proud to be standing with my colleagues, but the issue is not speaking to a room of like-minded folks or like-minded legislators. We need to impress upon certainly our senators, Senator McCormick and so many others, and Senator Fetterman, but also we need to reach out to our Democratic and Senate Republican Senate and House members in Harrisburg, because we know we've got great support with Congresswoman Lee and Congressman DeLuzio, but we need to talk to our Republican senators in our case to ensure that they understand the impact it's going to have on rural Pennsylvania, where those hospitals are going to close down, where those healthcare centers are going to be closing down because they don't have the resources to support what's going to be done. They need to stand up and take their head out of the sand and move forward and say, this is what's happening. We're not going to stand by it. Lock arms with us and take the steps that we need to be taken to be able to address this. Because if we stand unified, as Democrats and Republicans, sending a very strong message to the senators in Harrisburg and Washington, D.C., I know we'll be able to stall some of these things that are taking place. And as we go forward with our budget conversation, we're at the end of June in Harrisburg. We don't know where we're going to stand at the end of the day. And as was mentioned by Senator Williams, it sounds like this bill is getting worse, not better. So we have more work to do. I'm proud to be standing with my colleagues to amplify this message and hope that people listen to what's happening and recognize it's going to help them and it's going to impact them in a significant way. And we need to take very drastic steps to be able to address what needs to be done. So thank you very much for having me, and I look forward to answering any questions folks might have. Thank you. Appreciate it. Thank you.
Right, at this time, we're going to have Alex Jutka from Allegheny County Department of Human Services. Thank you.
Thank you all. It's been stated here earlier today, Medicaid is critical for Allegheny County safety net. So approximately 248,000 people, nearly 1 in 5 in the county, are currently rely on Medicaid, including 39% of children. Medicaid pays for especially vulnerable groups, including about 2/3 of nursing home residents and over 9 in 10 children involved in child welfare cases in the county. This means that Medicaid isn't just a budget line, it's a lifeline, whether it's for an older adult who needs a nurse or someone who helps them to get dressed, or a child in foster care who needs a trauma therapist or a visit to the pediatrician. Medicaid funds about $400 million in behavioral health services, so that's substance abuse, mental health, and intellectual disability annually. That's about 40% of the entire Department of Human Services budget. Losing federal match dollars, which represent about 55 cents for every dollar spent, would result in a gap that local funds simply cannot fill. This would create a gap in critical services, whether it's counseling session for a person in early recovery, in-home supports for a child with autism, or support for a mom with postpartum depression. Second, the pending federal Medicaid cuts would have large effects locally. State analysts estimate that about 25,000 Allegheny County residents would lose coverage under the House reconciliation bill. DHS clients would face potential gaps in mental health, substance use, and disability services that currently flow through Medicaid. The cost to cover the uninsured would shift to other county funds, which would force very hard trade-offs and potential cuts either to health care or to other important critical services. Other proposed cuts that may simultaneously hit the U.S. Department of Housing and Urban Development, SAMHSA, aging, and workforce grants would further force DHS to triage needs. One underappreciated consequence beyond the healthcare impacts is that Medicaid cuts could cause crime to increase. So there's been recent, really interesting and very compelling work looking at things like what happened in Tennessee when there was a large disenrollment event of adults that found that crime rose. There's been similar work done in South Carolina that looks at what happens when patients are disenrolled at age 19. Both have found increases in crime. I think that this just speaks to the fact that when we don't invest in help that people need, it affects all of us. Lastly, work requirements will result in higher administrative costs that will be borne both by the government and will represent higher burden for our clients. So the experience of work requirement states such as Georgia suggest that these criteria increase administrative costs for the government. These requirements also threaten access as individuals struggle to maintain coverage due to administrative burdens rather than legitimate eligibility reasons. This further risks diverting staff away from helping serve clients directly into making sure that paperwork is up to date and complied with. So there's a compounding effect here. Not only will cuts make it harder for people to get help, it will place more burden on the government, taking even more resources away from people getting the help that they need. Thank you.
Thank you so much, and thank you for your participation today, and to Congresswoman Summer Lee, Mayor Gainey, Senator Williams, Senator Costa, Alex, represent the DHS. We have to fully understand that this is a very serious time. And we also want to keep our politicians lifted up in prayer as well, as we know that this climate is very intense, and that they will continue to be able to safely represent the individuals in which they have been elected to serve. So let's make sure that we do that. At this time, I'm going to open it up for a couple of questions that you may have directed towards any of these individuals on the platform. Yes, sir.
What percentage of the patients that you see every year are Medicaid patients?
Greater than 30%.
Thank you.
Thank you. Anyone else? All right, if that is it,
Thank you.
thank you. Have a great day.